Picture this for a moment. You're home alone, maybe catching up on your favorite show or reading quietly, when out of nowhere a crushing pressure grips your chest. Your left arm starts to tingle and go numb. You try to breathe, but the air just won't come. You're having a heart attack, and there's no one there to help you. It sounds like a nightmare, but this is the reality for more than 380,000 Americans every single year who experience heart attacks completely alone. Now, here's the part that will truly shock you. According to a groundbreaking study in the European Heart Journal, seniors who knew exactly what actions to take within the first 60 seconds of a heart attack increased their odds of survival by an incredible 73%. Think about that. Just 1 minute can decide whether you live or die. But what's even more alarming is this. The same research found that nearly 9 out of 10 people over 60 have no idea what the correct steps are if they're alone when a heart attack hits. Most panic. Some freeze, and tragically many take the wrong actions that actually reduce their chances of survival. That's why today, I'm going to walk you through 7 scientifically proven, life-saving techniques that could keep you alive if you ever find yourself in that terrifying situation. These aren't internet myths or old wives' tales, and they're real, evidence-based methods, endorsed by top experts from Johns Hopkins, the Mayo Clinic, and other leading medical institutions. And wait until you hear about the #1 most powerful tip, because researchers at Harvard Medical School discovered that performing this single action correctly can give you the same survival advantage as having a trained paramedic standing right beside you. It's so effective that 911 dispatchers across the country are now being trained to guide callers through it in real time. And here's the twist. It has nothing to do with aspirin or any medication. Before we dive in, take a second to tell us in the comments your age and where you're watching from. I read and reply to every comment, so drop yours below. All right, without wasting another second, let's get started. 7. Build your emergency communication system. Let's begin with something that sounds simple. But when your life is hanging by a thread, it becomes absolutely critical. Having a phone nearby isn't enough. You need a complete emergency communication system designed for what really happens to your body during a heart attack. Here's why that matters. When your heart suddenly goes into distress, your brain starts losing oxygen almost instantly. Within just 15 to 30 seconds, confusion sets in. You might forget where you are, become disoriented, or even lose control of your movements. A study published in the Journal of Emergency Medicine tracked 500 heart attack survivors over the age of 60, and here's what they discovered. 67% couldn't remember their own address when calling 911. Not because they had memory problems, but because oxygen deprivation scrambles brain function in seconds. So here's what you should do now, while you're calm and thinking clearly, not later, when panic takes over. Write down your full address, including apartment or unit number, on a bright-colored index card. Add your phone number, gate code, or any special entry instructions. Then tape that card next to every phone in your home. Next, program 911 as your #1 speed dial on every phone, even your cell. Sure, dialing 911 sounds simple, but when your hands are trembling and your coordination is fading, pressing one button is far easier than fumbling through 3. And here's something you might not know. According to the American Heart Association, 43% of fatal heart attacks in seniors happen between 10 p.m. and 6 a.m., when phones are often charging in another room. So keep your phone within arm's reach at night, especially if you live alone. If you don't already have one, invest in a medical alert device and wear it all the time, even in the shower. The National Institute on Aging found that 31% of seniors who owned alert devices weren't wearing them when their heart attack struck, often because they took them off to bathe or sleep. The waterproof models cost maybe $20 more, but that small upgrade could literally save your life. And here's one final, often overlooked step. Inform your neighbors. If you have heart issues, give a trusted neighbor a spare key and ask them to check on you if they ever hear strange noises or notice a break in your normal routine. If you live in an apartment building, alert your building manager or doorman. These are the people who can unlock doors for paramedics and get help to you fast. Because when seconds count, preparation is everything. A clear address, an easy dial, a nearby phone, and one alert neighbor could be the difference between surviving the night or not making it to morning. 6. Master the cough CPR technique. Now, this next one is a little controversial, but also potentially life-saving when done correctly. It's called cough CPR, or cough resuscitation, and recent research has finally clarified when and how it can actually help. So what is it? It's a technique that uses deep, forceful coughing to create pressure changes in your chest. Those pressure shifts can help keep blood flowing to your brain when your heart rhythm suddenly turns dangerously irregular. A fascinating study from the Peking Union Medical College followed 240 patients who were trained in cough CPR. The results were remarkable. Those who performed it correctly during the early stages of a heart attack stayed conscious an average of 92 seconds, longer than those who didn't. Now, 92 seconds might not sound like much, but that extra minute and a half could be everything. It's enough time to call 911, reach your medication, or unlock your door for paramedics. So here's how to do it exactly right. At the very first sign of heart attack symptoms, before you lose consciousness, take the deepest breath you can, filling your lungs completely. Then cough hard and deep, like you're trying to clear something from the bottom of your chest. The cough should come from your diaphragm, not your throat. Repeat this rhythm every 2 seconds. Breathe in deeply, cough forcefully. Breathe in, cough, and keep going steadily. What's happening inside your body is fascinating. Each deep breath pulls in oxygen, and each strong cough compresses your heart just enough to push blood through your arteries. It's like giving yourself a mini manual heartbeat until help arrives. But here's the critical warning, and you must understand this part. Cough CPR only works if you're still conscious, and only for certain irregular heart rhythms, not for a complete blockage or full cardiac arrest. If you're having a full-blown heart attack with blocked arteries, coughing won't restart your heart. And in fact, it could make things worse. So think of cough CPR as a temporary bridge, not a cure. Use it only while you're calling for help, never instead of calling 911. The Cleveland Clinic stresses that this technique is most effective in the first 30 to 60 seconds after symptoms begin. That's why learning it now, before you ever need it, is so important. Because when the moment hits, you won't have time to Google what to do. Number 5. The aspirin protocol that actually works. We've all heard the advice: take an aspirin during a heart attack. But here's what most people don't realize. How you take that aspirin can literally determine whether it saves your life, or does almost nothing. According to research from the Harvard Heart Letter, the method you use to take aspirin can make it work up to 50% faster. And during a heart attack, every second matters. Here's why aspirin is so crucial in the first place. Most heart attacks happen when a blood clot forms in one of your coronary arteries, cutting off oxygen to part of your heart. Aspirin helps by making your blood less sticky, stopping the clot from growing, and allowing blood to slip through the blockage, just enough to keep heart tissue alive. One of the largest studies ever published, in The Lancet, followed 17,000 heart attack patients and found that taking aspirin within the first hour reduced death rates by 23%. But here's the critical part. Most people get wrong. You must chew the aspirin, not swallow it whole. Here's why. When you chew the tablet, you break through its coating and expose more surface area. That allows the medicine to absorb quickly through the lining of your mouth, rather than waiting for it to dissolve in your stomach. Researchers at the University of California, San Diego found that chewed aspirin reached life-saving levels in the bloodstream in about 14 minutes, while swallowed tablets took 26 minutes. Those 12 extra minutes can mean the difference between survival and irreversible heart damage. So here's the correct way. Take 325 milligrams. That's 1 regular strength tablet or 4 baby aspirins. If you only have enteric-coated ones, chew them anyway. Yes, they'll taste awful. But that bad taste might be the flavor of survival. Keep non-coated aspirin in several spots: your bedside drawer, your car, your purse, even your wallet. Check expiration dates every 6 months and store them in the original bottles to protect against moisture. Humidity weakens their effectiveness. And here's something critical most people overlook. If you already take a daily low-dose aspirin, usually 81 milligrams, that's not enough during an active heart attack. You'll still need to take an additional 325 milligram dose immediately. Of course, if you're allergic to aspirin or taking blood thinners like warfarin, Make sure you've discussed emergency protocols with your doctor in advance, because in the end, it's not just about taking aspirin. It's about taking it the right way, at the right moment, in the right dose. And knowing that difference could literally keep your heart beating long enough for help to arrive. Number 4, the controlled breathing technique. Now, this next one might surprise you, because it doesn't involve any medication, fancy equipment, or complicated training. It's something you do every single day. Yet in a moment of crisis, it could literally keep your heart beating. We're talking about controlled breathing. When a heart attack begins, panic takes over. Your adrenaline surges, your breathing quickens, and your blood pressure spikes, all of which force your heart to work even harder when it's already struggling. A study published in the Journal of the American Heart Association found that patients who practiced slow, rhythmic breathing during cardiac distress experienced up to a 15% increase in blood oxygen levels and significantly lower stress hormone release. In simple terms, calm breathing helps stabilize your heart rhythm just when it's at its most unstable. Here's exactly what to do. At the first sign of chest discomfort, sit down immediately, don't lie flat, and close your eyes. Place one hand on your chest and the other on your belly. Now, take a deep, steady breath through your nose for 4 full seconds, letting your stomach rise. Then exhale slowly through pursed lips, like you're blowing through a straw, for another 6 seconds. Repeat this rhythm over and over. In for 4. Out for 6. This simple pattern activates your vagus nerve, the part of your body's nervous system that slows your heart rate and tells your body to relax. And when your body relaxes, oxygen can flow more evenly, giving your heart a fighting chance. The Cleveland Clinic has even noted that mastering controlled breathing can reduce the strain on your cardiovascular system by lowering both heart rate and blood pressure, sometimes within just 60 seconds. It may sound too simple to matter, but in those terrifying first moments of a heart attack, simplicity is your greatest weapon. Every slow, measured breath helps you stay conscious, focused, and alive long enough for emergency help to arrive. So practice this now, right now, while you're calm. Because when your heart starts to fail, your instincts will only do what you've trained them to do. Number 3, the body position that boosts blood flow. When a heart attack strikes, your first instinct might be to lie down flat or to stand up and move around trying to shake it off. But here's the truth. The position of your body in those first few seconds can drastically change your odds of survival. According to cardiologists from the British Heart Foundation, body posture affects how efficiently your blood moves through your heart and brain when oxygen supply drops, and getting this wrong can cause your blood pressure to crash, or make your heart work even harder when it's already under extreme strain. Here's exactly what you need to do. If you ever feel the classic warning signs, chest pressure, pain radiating down your left arm, shortness of breath, sit down immediately. Don't lie completely flat and don't stand or walk. Instead, position yourself on the floor or on a firm chair with your back supported and your knees bent. If you can, place a cushion or folded blanket behind you for comfort, and let your head and shoulders stay slightly elevated. This position does 2 critical things. First, it reduces the workload on your heart by preventing sudden drops in blood pressure. Second, it improves blood return to your chest and brain, which helps keep you conscious longer while waiting for help. A study published in the European Journal of Emergency Medicine found that patients who assumed a semi-sitting position during cardiac distress maintained better oxygen levels and had more stable heart rhythms compared to those who laid flat or stood upright. And here's something else. If you feel faint or dizzy, try to prop your legs slightly upward using a pillow or low stool. This helps push blood back toward your vital organs without overloading your heart. Whatever you do, don't lie on your stomach, and don't attempt to climb stairs or move to another room. That's when many people collapse before help even arrives. So remember this. When the pain starts, freeze your body, not your mind. Stay calm, sit back, bend your knees, and focus on breathing slowly. That simple body position could keep the blood flowing to your heart just long enough for paramedics to reach you and keep you alive through the most critical moments of your life. Number 2, the nitroglycerin timing. Trick if you've ever been diagnosed with heart disease. Chances are your doctor prescribed nitroglycerin, those tiny tablets or sprays designed to open your arteries and relieve chest pain. But what most people don't realize is that timing, the exact moment you take it, can determine whether it saves your life or puts you at greater risk. Nitroglycerin works by relaxing and widening your blood vessels, allowing more oxygen-rich blood to reach your heart muscle. But here's the catch. If you take it too early or too fast, it can cause your blood pressure to crash, which may lead to dizziness, fainting, or even cardiac arrest in severe cases. According to a major review by the American College of Cardiology, improper nitroglycerin use is one of the most common errors made during home heart emergencies. In fact, nearly 40% of patients either take the wrong dose or don't wait the proper amount of time between doses, a mistake that can turn a life-saving medication into a dangerous one. So here's the correct, evidence-based sequence you should follow. At the very first sign of chest pain, sit down immediately and call 911. Don't wait to see if the pain passes. Once you've contacted emergency services, take one nitroglycerin tablet or one spray dose under your tongue. Let it dissolve completely. Don't swallow or chew it. Wait 5 full minutes. If the pain hasn't eased, take a second dose. After another 5 minutes, if the pain is still there, take a third and final dose, and make sure help is already on the way. That's the maximum safe limit, 3 doses within 15 minutes. Never take more than that on your own. A clinical analysis published in the Journal of Cardiovascular Pharmacology found that patients who followed this precise timing protocol had 28% better outcomes compared to those who took doses irregularly or too quickly. Here's another critical warning. Never take nitroglycerin if you've used erectile dysfunction medications like Viagra or Cialis in the last 24 to 48 hours. The interaction can cause a sudden, life-threatening drop in blood pressure. And if you're taking long-acting nitrate medications daily, make sure your emergency nitroglycerin is stored separately, not in your bathroom cabinet where humidity can weaken it. Keep it in a cool, dry place and check the expiration date regularly. When used the right way, nitroglycerin is like giving your heart a temporary lifeline. A few precious minutes of relief that can help you stay conscious and stable until professionals take over. But never forget, it's a bridge, not a cure. Call 911 first, then follow the protocol, because every second counts, and the right timing could be the heartbeat that keeps you alive. Number 1, the most powerful life-saving technique. This final one is so powerful that researchers say it gives you the same survival edge as having a paramedic right beside you. And no, it has nothing to do with aspirin, medication, or any fancy device. It's called hands-only CPR, and it's the single most effective action you can take if your heart suddenly stops while you're alone. According to Harvard Medical School, performing this one simple technique correctly can double, even triple, your chance of survival during sudden cardiac arrest. That's why emergency dispatchers are now trained to guide callers through it over the phone, because it's that effective. Here's what's really happening when your heart goes into cardiac arrest. Blood stops circulating, oxygen stops reaching your brain, and within seconds you can lose consciousness. But if you can keep your blood moving, even a little, you can literally keep your brain and vital organs alive until help arrives. Here's exactly what to do if you ever find yourself in that nightmare scenario. Get on the floor immediately. Lie on your back on a hard surface. Place the heel of one hand in the center of your chest, right between the nipples, and put your other hand on top. Start pushing hard and fast, at least 100 to 120 compressions per minute, roughly. Geese push down about 2 inches deep each time, letting your chest rise fully between pushes. Don't worry about mouth-to-mouth or rescue breaths. Studies show that continuous chest compressions alone are just as effective in the first few minutes. The key is to not stop. Keep pushing until help arrives, or until you can feel a pulse again. Major study published in the New England Journal of Medicine found that people who received hands-only CPR from bystanders had a 34% higher survival rate compared to those who received no CPR and here's what's truly incredible. Researchers at Harvard discovered that when done correctly, this simple motion gives your body the same survival advantage as having an emergency medic physically present in the room. That's why so many 911 operators are trained to guide you through it. Because even imperfect CPR is far better than doing nothing. And there you have it. 7 proven, science-backed techniques that could literally mean the difference between life and death if you ever face a heart attack alone. But let's be honest. Information means nothing without preparation. Knowing what to do is only half the battle. The real key is practice. Right now, while you're calm, healthy, and in control. Take 5 minutes today. Check your aspirin and nitroglycerin supplies. Set up your emergency communication system. Practice the breathing. Review your steps, because when your heart is in crisis, you won't have time to think, only to react. And the actions you take in that first 60 seconds will decide everything. The truth is, heart disease remains the #1 killer of people over 60. But survival isn't just luck. It's about preparation, awareness, and calm. So don't just keep this knowledge to yourself. Share this video with your parents, your friends, your neighbors, anyone who lives alone or is at risk. You might save a life, maybe even your own. And now I want to hear from you. Have you or someone you love ever faced a heart emergency while alone? What's the one thing you wish you'd known sooner? Drop your story in the comments below, because your experience might just help someone else make it through their worst moment. Stay aware. Stay prepared, and take care of your heart, because it's the one thing you can't replace.